Yavuz Bey, we can start.
Okay. Thank you very much. Dear guests, our dear speakers, and dear participants, welcome. On behalf of AXA, TÜSİAD, and Institut du Bosphore, I really would like to welcome you today to our webinar entitled Mental Health Resilience Towards the Post-COVID World Work Practices. As we all know, the COVID-19 pandemic, besides its global dimensions, has also significant implications in the emotional, psychological, and social well-being. And as AXA Insurance, we believe that in any case, this coronavirus-related diseases will end soon, but unfortunately, lasting consequences of pandemic will continue. In this context, in collaboration with Galatasaray University and Institut du Bosphore, we have published a report entitled COVID-19 Pandemic and Mental Health that delivers research findings on attitudes and behaviors of white-collar workers and youth. This research, carried out the end of summer 21 in Turkey, aimed to enlighten the readers about the a new normal after COVID-19 pandemic, and to understand its economic, psychological, and social effects of life after pandemic. This study is also aimed to provide a supportive framework for further researches on social factors affecting mental health by providing an understanding of these important changes in daily life after COVID-19 pandemic. I herewith would like to thank once more to Galatasaray University and Institut Bosphore for their invaluable contributions and support for the research. Moreover, herewith we would like to also extend our gratitude to business at OECD, where TÜSİAD is a member, as this research was also widely shared within the scope of a business initiative, so-called Stronger Together, health campaign on resilience and foresight. Today, we will begin our webinar with the key findings of the report. Following our esteemed speakers will tackle the role of governments and business in building mental health resilience. I personally expect to find some answers for the upcoming days or next challenging ahead of us. And I'm sure that within the limited time frame, we will understand more how we can overcome the COVID-19 pandemic repercussions. Now I stop here and I let Feyza Hanım for a further introduction to speak. Thank you.
Thank you, Yavuz Bey. And me also, I want to thank so much to AXA, TÜSİAD, and Institut du Bosphore to support our research, because it was so important for us academicians to be able to do this research, finding some economic support. And I want to start by explaining the scope of research and main findings. In March of 22, we all faced an extraordinary situation, as you know. COVID-19 is the first global health crisis in the digital era, where public health policies are based on virtual connectivity to maintain physical social distancing. The restrictions imposed on societal conditions and economic activities to contain the COVID-19 outbreak in mid-March 2020 have created varying degrees of difficulties in the lives of individuals. In addition, the virus has created a very big health crisis in recent history, causing many concerns among the public. In this context, in the research, we aimed to understand the impact of COVID-19 in the society and working life, and how the family life and mental health of white-collar workers were affected by this global pandemic. In this study, it has been investigated how and what extent their daily lives have changed due to the extra responsibility caused by the lockdown when they had to keep everything together. For example, school closures, housework, caring for family members. At the same time, the problems experienced by young people as a result of being away from school, job opportunities, and social relations during the most productive periods of their lives, and how these changes affected their mental health were also investigated. For this, two different techniques, qualitative and quantitative methods were used simultaneously in the field stages. The quantitative research was conducted with 1,300 subjects over 20 who representing the white collar population. The qualitative research that we carried with our assistant in Galatasaray University Sociology Department have been conducted with 20 high school or university students aged 14 and 25 with white collar worker families. They were in-depth interviews. I will come very briefly to important results because this research has revealed two effects of the crisis on the state of people's social relationships. The others we can talk after if you want. One is the decrease in a social solidarity, and the other is increase in feelings of loneliness. Half of the white-collar workers thought that social solidarity decreased during the coronavirus period. Such negative feelings diminish only as the solidarity in the society increases. Nearly 2 out of every 3 white collars state that their neighborly relations declined. 43 of the interviewees said that verbal violence increased in their environment during this period, and 38 reported an increase in physical violence. Qualitative student interviews also confirmed the survey results. About half of the youth who were interviewed reported that pandemic had a negative or devastating effect on their mental health, while half reported feeling sad, depressed, or helpless. Stress symptoms were expressed quite a lot as well. They had difficulty sleeping and experienced loss of appetite. The percentages you can all find in this very large report. What I can say to explain about the two important findings, maybe two concepts we met during the pandemic period, because these two concepts have deepened these problems: social distancing and life fits home. Because in Turkey there was a slogan, Hayat Eves Var, life fits home. The concept of social distance presented to us as the new way of life is problematic and misleading, I think. In fact, we don't need to be socially distant. It's sufficient that we respect a certain physical and spatial distance. For many people, however, the physical distance automatically means less social contact, less intimacy, and therefore truly social distancing. The current situation has been particularly difficult for the elderly, who are at greater risk of loneliness due to their living conditions. Video chatting with family and friends on the phone or online was one of the main ways to communicate with others during the lockdown. In this period, 77% of individuals communicated with the environment by talking on the phone, or 73% by video talking or messaging applications. Likewise, the whole family couldn't fit in the house. Due to the closure of schools, the isolation of the elderly, and increasing number of patients at home during the COVID-19 pandemics, it seemed that the burden of these duties increases, especially for women and girls. This has had negative effects on maintaining the balance between work and private life while working remotely. Donc, families who tried to organize home and the school, wanting to meet all the expectations of the teachers, quickly realized that they didn't know how to do this. This situation also revealed a sense of excessive responsibility mixed with guilt in parents. Therefore, reopening school was important for them. 53% of white-collar employees think that even if the coronavirus is not under the control, it's necessary to physically open schools and continue normal education by taking necessary precautions. And providing a more equal, I think, more peaceful and more successful environment and condition in both working and educational life will positively affect the mental health of individuals. As I said, I shared here because I don't have so many time, but we can discuss in the discussion period, two major effects of the crisis I wanted to talk about: decrease in social solidarity and increase in feelings of loneliness. I think that I finish for now, and I want to continue in the discussion period.
Okay, then. I want to start by wishing everyone a good afternoon. As of tomorrow, before we take a short holiday break in Turkey, we will discuss a topic that will be very helpful and very good for all of us, since we are all affected by COVID. Thank you to our valuable guests. Feyza Hanım, if you wish, let's start with you. As you mentioned now, and as you mentioned in your research, COVID has affected our mental health in many different ways. The search of meaning in our work, the dimensions of our work, family, friendship, relations, etc. In addition to this, your research reveals two substantial effects of the pandemic on people's mental health: a decrease in social solidarity, you previously talked about it, and an increase in feeling of loneliness. I believe we all felt that. Considering the extensive research of this report, could you elaborate your recommendations for the future of work and education after the pandemic, please?
Yes. Thanks. I will try, because the other contributors maybe will tell more important things than me, because the sociologists interest mainly the society, but the future is always difficult for us to talk about. But I can see some signs. For example, as you tell, work and education, I think it's two main important area that we have to, how can I say, retransform, change everything. We saw this. Some organization maybe will resume pre-COVID-19 working norms. Maybe others entirely will pass to remote working. But we can see that we knew the hybrid model. Then maybe the suggestion will be for us, the researchers, the traditionally office-based companies have to operate some form of hybrid model. Because the hybrid model, some positive effects of hybrid model could allow employers to attract more geographically dispersed talent, maybe potentially productivity, maybe around different culture, and it's something positive, I think. But also they have to make attention some kinds of communications systems, or sometimes of continuous formation system. For example, to promote gender equality, I give an example, just one suggestion. It was a very important occasion because I'm working also about gender. By encouraging, for example, and supporting more men to work flexibly, companies promote gender equality. Then the women's, because in this period, women's were under very big pressures at home, working, children, and domestic housework, everything. And maybe it will be an occasion to promote gender equality by encouraging the man also to work flexibly. Another suggestion, what I told recently, review the communication process. For example, what can I say? The Zoom, there was a wording about the Zoom fatigue. You understand that?
Yeah.
The new concept, Zoom fatigue. To eliminate these kinds of pressure coming from technology, maybe the managers can encourage, I think, that informal social communication to pass very, because we will work from home, but also the communication cannot continue as before it in the ancient system. I think that many other things can be said, but for the education, I think, to tell something also about education, because I'm also a teacher. I was teaching. I'm teaching always at university. It was a very important, I think, experience for me, because I think that educators like me, professors, have to develop new ways of communication system with students away from classroom, because we have to accept, but many students don't have economically or by the space this technological support. And they don't know, not only financially, you can give them the computer, but they don't know how to use it. Yeah, we also find some system from state or from other companies to teach all the generations from Z, Alpha, maybe they know, but the other also to know about the technology using, I think, education, future generation about this. Also, educators must change. I think also that for education in the future, you said resilience, for example, new characteristic like, for example, resilience, adaptability, flexibility, continuous learning will be most important in the future. New skills also have to be passed to the students, I think.
Yeah. As always, COVID impact was devastating for women and young people. We are unlucky for that.
Yes.
Anyways,
mostly.
My understanding as a woman myself, I can relate to. And Shunta, thanks again for participating. Tackling mental health of the working age and young population is also a key issue for labor market and social policies in OECD countries. How can skills, work and youth policies can be integrated in a way to promote good mental health? What are the main OECD public policy recommendations to governments for improving the social well-being in digital era? I really wonder the answer of this question.
Well, thank you very much for the invitation. It's a pleasure to be here. So my name is Shunta, and I work in the OECD in the Directorate for Employment, Labour and Social Affairs. You've given me a lot to cover in 5 minutes or so. I think most of my answer will be, most of my answer will be to question 1, but I will also touch on the digital element at the end. Yeah. So maybe just what do we actually mean by integrated mental health policy here at the OECD? What that means is that when we design policies across different areas, whether it be education, workplace, employment, social welfare, we need to think about the mental health impacts of policies. So of course, a very clear example is with containment measures, like when we're thinking about the costs and benefits of that, the mental health should be considered. And I think in that case, it sometimes was, but we too often still see actually that mental health considerations and impacts of policies often not seen and not kind of calculated within those considerations. And this is really actually the core of the work we do at the OECD based on what we call the recommendation on integrated mental health skills and work policy. And it's a legal instrument which all OECD countries, including Turkey, have adhered to. And basically by adhering to this recommendation, OECD countries are basically saying we commit to doing our best to improve the social and labour market inclusion of people with mental health issues. And just briefly, why we need this important approach? Well, that's because, I mean, I think everyone here is on the same page, but the burden of mental ill health actually falls primarily outside the health system. And we're really pushing to get policymakers to think outside of health ministries as well, and education ministries and labour ministries, that they need to see mental health as a priority there as well. And they've estimated around 4% GDP cost of mental ill health in Europe, for example, about a third, actually more than a third of these costs come from labour market impacts like lowered productivity, increased absence, reduced employment, or increased social security expenditures. And we also know, of course, that we're far from the full inclusion of people with mental health conditions. For example, are 20% less likely to be in employment. And even if they are in employment, they actually earn about 17% less than counterparts without a mental health condition. And of course, the other element, and when thinking specifically about the role of workplace policies, because that's my area of expertise, we need this approach because actually, of course, what I was just saying is that mental ill health impacts productivity, but likewise, the nature of work is a key determinant of mental health. So being in work is, we say, generally good for mental health, but being in a job where you're underpaid or have too much to work or work long hours, lack autonomy, all these kinds of things, that is bad for mental health. So clearly we need to be doing work to improve the quality of work as well. Now, what we actually did was a 5-year review of the recommendation from 2020 to 2021. So the recommendations from 2015. And what we found is that psychosocial risk, for example, is increasingly integrated within what we call occupational safety and health considerations. There's not enough of a focus on promotion. So a lot of the focus is on dealing with mental health issues once they arise, rather than promoting mental health amongst all employees. The UK and Canada are a bit of an exception in that sense. They have guidelines that specifically are to do with mental health in the workplace and are far broader than the traditional scope of occupational health and safety. And for example, the Canadian standard for psychological health and safety in the workplace identifies as many as 13 priority areas. And it's not just about workload management and access to counseling, but also organizational culture, providing opportunities for growth and employment and development, and maintaining connections with employees. And just a key area for us to think about is there sufficient support for people with mental health conditions who are on sickness absence? When we did this 5-year review, basically what we found was there's too many mechanisms that promote people with mental health issues who could work with the right support. They're pushed to leave the labor market as opposed to return to work. And there's a gap where after a while, someone on sick leave doesn't receive support either from the employer or the social security system. So I think we can learn here from certain country practices. So in Austria and Norway, for example, employers have to come together with employees to co-develop return to work plans. You have countries like Canada, Netherlands, Germany. These are countries that have what we call phased return to work schemes. The idea of that is instead of seeing work as 100 or 0, you allow workers who've been on sick leave for a while, for example, due to mental health issues, to return in a partial capacity and gradually scale up their capacity back to 100%. And I know this is already a theme of today, and it's already been raised by you, Asli, the moderator, but we also need to think about the mental health of young people. We've been doing work to understand the impact of COVID-19 on young people's mental health. And what we see is across basically every country where we can find data that the impact on mental health is larger amongst young people than other age groups. Just one crude number, but actually, for example, in the US, 50% of 18 to 29-year-olds are estimated to be experiencing symptoms of anxiety disorder, depression disorder, and this is right now, almost more than 2 years into the pandemic. So we need to think about this in education too. We need to prevent, for example, early school leaving. We need to strengthen the connection between education and health services. We need to prioritize social emotional learning in schools, because too often, what we find is right now the focus is on expanding emergency support. So France, for example, is doing plenty to do this, but there are actually underlying structural issues that need to be addressed. And just very quickly, coming to the last point on my tips for the digital era, I'm going to focus specifically on the workplace and this remote work, hybrid work, teleworking, because I think that's an area of interest based on what I read from the report, because you're looking at white collar workers and giving the audience as well. It's the same as any other work insofar as work in itself can be good or bad for mental health. Now, the key question is, what is the regulation? What are the policies? What is the framework around teleworking? And what are line managers, what are senior executives doing? Because, teleworking, remote working, that comes with opportunities as well, as Feyza said, it can provide work-life balance. It gives employees more time and control over where they might work and what time they might work. But at the same time, on the other hand, it can, challenge home and work boundaries. There's evidence to suggest that people tend to work longer hours and less predictable hours. And I think when we're thinking about young people, we need to keep in mind that this is a particularly big issue, I think, for young people who are often new to their workplace. They've never met their work colleagues. And imagine, going into a workplace where you've never met and you have to do it all remotely, So it's easier, I think, for people who have stronger connections to the workplace they can draw on. Whereas for younger people who tend to be at work for a shorter period in that company, face additional challenges. And one policy we've seen, which is interesting, but we're still to see whether it really fully works and what that looks like, is the right to disconnect. And the idea of that is that it is to enshrine the right for workers to disconnect outside of working hours. So actually, France was the first to implement a measure like this. Many countries, ranging from Colombia to Slovakia, followed suit. But the challenge is actually to understand that the intention is great. So the idea is, by allowing people to actually switch off after work, it provides them with that work-life balance. And in an all-digital world, it gives them the space to relax, rest, get the sleep they need, and things like this. But just legislation alone isn't enough. From what we've seen. So in France, for example, there was a survey by a trade union in 2021. And what that actually showed that even though there had been a right to disconnect in the law since 2015, actually around 60% of employers didn't have such a system in place. So I think this is the big challenge here, is that, yes, we're catching up on the policy side to meet the challenges and the benefits of the digital age for mental health. But there's still a long way to go. So I'll leave it at that for now. Thanks.
Yeah, it could be, can apply by all, how can I say, governments and private sector, public sector. It's so common advice. Thank you very much. You summed it up very well, but I'd like to hear from you more in detail That's why I want to be in touch with you, Shunta. And Julie, hi again. Business at OECD has recently launched a campaign on health resilience and foresight, which calls on governments and the OECD to empower, involve, and incentivize and deepen work on health policy. What are the main business priorities on health policies? If you must name a few, could you also say a few words about this special campaign, please?
Thanks, and many thanks, Asli, for your question. Good afternoon, everyone. It's a real honor and pleasure to be virtually with you today. Maybe just a few words of intro. My name is Julie Chauvet. I'm actually on a secondment at Business at OECD. And I am originally working for Novartis as a Director of Public Affairs in Brussels. So while at Business at OECD, I'm leading on the health resilience campaign, and it's in that quality that I'm here today with you. So Business at OECD, just to clarify, is the official business voice to the OECD. We are conveying business perspective and expertise to policymakers on a broad range of global economic governance and policy issue since actually 60 years already. So we support policies that would enable businesses of all sizes to contribute to sustainable growth, broader economic development, and enhance societal prosperity. So to your question, Asli, why a campaign on health resilience? I think as business representative, we have all witnessed firsthand how COVID-19 pandemic placed considerable burdens on societies, on our companies, and on our governments. So we now have an opportunity to actually apply the lessons learned from these 2 years and ask government to address links between health and economic productivity more clearly. This means a tangible role for the OECD policy making to ensure that its health division duly recognizes business as a solution partner going forward. I also believe that a clear picture emerges. Health systems are intertwined with country economic productivity and societal well-being. We all know that resilience preparedness are not luxuries, but really a necessity nowadays. We also face a double challenge, ending the current pandemic chapter, though infections are still in the million worldwide and many people are still in lockdowns today, and starting now preparation for the next potential shock. Lack of preparedness and fragmented responses are likely to undermine the benefits that coordination of health security measures has brought so far. So we are not winning for the moment against fights against non-communicable disease, for instance, which represent the #1 cause of population mortality and morbidity nowadays. We also all know that the next shock could come from a new variant or another infectious disease. Antimicrobial resistance is also a big problem, or also from non-communicable disease, or yet another unforeseen global geopolitical disruption that I will not name today, but that could collapse healthcare system and people's lives. And that's how we decided actually to launch a campaign in collecting best practices and initiatives from members. Our health committee has leveraged this information to develop a set of tangible recommendations to the OECD and its governments. And we have delivered this during our participation in the ministerial in June and at the health committee meeting of the OECD in July. And this campaign is also paving the way towards our 5th Business at OECD Forum on Health, which we'll organize early 2023. The campaign also raises awareness around the importance of health and notably mental health among national business organizations, and increase our visibility and profile our business constituent as key solution partners. For the campaign so far, we really got fantastic input from members, including from TÜSİAD. So input from national business organizations, from sector federations, and from individual companies. And as you said, Asli, we have identified main trends and drafted a set of recommendations. And clearly, our campaign is calling the OECD and government to empower population to adopt hands-on approach to health and making citizen champion of prevention, involve economic research and employment ministers in all aspects of the policy making, incentivize scientific progress and acceptance to build a better future, and very important, to deepen the dialogue and involvement with business community to achieve these goals. So maybe more specifically, in those recommendations, we also outline government ministries we think should play a role in the design and implementation of those follow-up actions. And those are articulated around 5 big pillars. The first one is to invest in innovation. That means that the planning for the long term starts now. Ensure sustainability through value-based and person-centered health approaches, including a specific recommendation on mental health. Apply economic and health lessons from the pandemic and make prevention everyone's priority. And last but not least, leverage digital tools. So I will stop here and see if you have questions.
We listened some suggestions from both OECD, both business at OECD, as well as the university sides. If we can implement, if it's possible, if we can implement the half of the mentioned recommendations, both in our companies and in the government and in the health policies, we can prepare ourselves for possible new pandemics and unexpected situations like COVID. Yavuz Bey, what do you think as a closure, if you would like to say something?
First of all, many thanks for these very valuable comments. In a very short period of time, once more time, we have remembered what is this? I mean, time to time, while forgetting the recent past, we are not able to be ready for the future. My findings is very much similar, and as a closure in that respect. However, I have 2 more comments after the research, after the valuable comments. The uncertainty management and the change management are the 2 important for me topic in terms of readiness, because never ever in my company, being a manager in my company, we have so much invested in terms of culture about the uncertainty management. Even though we are in an emerging country, you know, uncertainty management is something very different, and we have a lot lessons learned in the past 2 years' time. And change management, typically we have, you are, you know, the expert in that respect in creating culture within the company by your role in the Eczacıbaşı group. But you know, when we speak about change management, it is always a topic of strategy, change management, business-wise. However, change management in overall of the life is also a topic that we have to be very careful on. Otherwise, if we are not investing in that 2 specific topics, the uncertainty down the road is not going to end shortly. That's why, to me, the valuable comments, the findings of this research is very valuable. But we should also conclude all those by encouraging even ourselves as the managers, fathers, mothers, wife, husband, whatever it is.
As a human being, yes, definitely.
Yes, as a human being, you know, we have to aware that we have to manage the uncertainty in a calm period of time.
Yes, that's true. I never had an experience that I had to decide millions of things in one day. Yes, I can imagine. I can relate it to very well. Okay, then thank you very much to all participants. Nur Hanım, Didem Hanım, if you would like to add something.
Thank you very much, everyone, for your inputs and your time to join us meeting. Thank you, and to
Thank
the
you.
audience.
Have a lovely day. Have a lovely holiday
Thank you.
for who lives in Turkey.
Yes.
Thank you very much.
Bye bye.
Thank you.
Thank you.
Thank you.
Thank you.